A man comes into ED. He has not opened his bowels in 3 days and is vomiting. Auscultation shows decreased bowel sounds and he has a collapsed rectum on digital rectal exam. What is your diagnosis? Hey guys, how you going? And welcome to the 6th episode of 5 Minute Medicine. My name is Kay and I'm a medical student who's created this podcast to give you the highest of high yield info on pathologies in only 5 minutes. So give our Instagram a follow as we'll be posting quizzes from the podcast and notes from the topic to help you excel in your studies. Our @ is 5.min.medicine. If you haven't guessed by the case already, today's pathology is on bowel obstruction. So what is bowel obstruction? Well, a bowel obstruction is literally obstruction of the bowel. This can be through extrinsic factors, factors outside the bowel, or intrinsic factors. These being obstruction to the lumen itself, or obstruction through a dysfunctional bowel wall. So let's mix it up today and jump straight into the pathophysiology. So bowel obstruction leads to stasis of luminal contents and obviously increases intraluminal pressure proximal to the obstruction. This causes many complications. So, distension of the bowel loops sequesters fluid within them, leading to dehydration and hypovolemia. There is nowhere for the gut contents to travel but upwards, causing the patient to vomit. This adds to the dehydration and hypovolemia, but also causes electrolyte loss, leading to metabolic alkalosis. Later, the bowel will necrose and perforate, causing peritonitis, and ischemic cells will enter the circulation to cause hyperkalemia. So now that we know the pathophysiology, the cardinal signs of bowel obstruction are easy to understand. We have abdominal pain, vomiting, constipation, abdominal distension, and decreased bowel sounds on auscultation, as all our bowel contents are essentially stuck. The severity of these will change based on the extent of the obstruction and the site, these being either the small or large bowel. The main causes for obstruction differ per site, so let's quickly address them. In the small bowel, the main causes of obstruction are adhesions, then incarcerated hernias. In the large bowel, the main causes of obstruction are malignancy, then diverticulitis and volvulus. So, what are some risk factors of bowel obstruction that should be covered on a history? Well, make sure to cover previous abdominal surgery. You also want to make sure to cover colon cancer risk factors, these being family history, age, obesity, inflammatory bowel disease, and polyposis genes. Make sure to cover previous colon cancers, Crohn's disease, hernia, and gallstones, as an ileus can cause obstruction as well. So how do we diagnose bowel obstruction? In a stable patient, a contrast CT of the abdomen and pelvis is done. In an unstable patient, abdominal X-ray and ultrasound is done first. The radiological findings are pretty easy to distinguish. There will be dilation of the bowel loops, air fluid levels seen, and air beyond the site of obstruction. Further details of this will be provided on our Instagram. So how do we treat a bowel obstruction? Well, let's start with supportive care. The patient will become nil by mouth, receive IV fluid resus for their dehydration and hypovolemia, electrolyte repletion from their vomiting, and a nasogastric tube in significant vomiting and distension. If the bowel obstruction is complicated, this meaning there's evidence of ischemia, perforation, or clinical deterioration, we will treat this surgically. An exploratory laparotomy is done to manage the obstruction. Gangrenous bowel is resected, and intestinal transit is restored. If transit cannot be restored, however, we can create a stoma. So guys, that concludes our 6th episode of 5 Minute Medicine. We hope you enjoyed listening, but most of all, we hope that you learned something too. So be sure to check out our previous episodes on pneumothorax, endometriosis, ectopic pregnancy, and many more pathologies if you haven't already. Give our Instagram a follow, our @ is 5.min.medicine, and DM us for any questions, and happy studying.